Okay, it's another day, different shirt, got some sleep. Hopefully, I can use my words. No promises. Um, I'm here to continue to go through the chapters for the Mental Health Virtual Reality Power of Immersive Worlds book. And we ended before with chapter 5. So we're on to chapter 6. And this chapter has my heart in so many different ways because, one, the author, we call her Mars. I'm probably going to butcher her name as well. It's funny because I've known her for a few years, but I've never heard her last name pronounced. I've only seen it in writing. So her full name, as it is in the book, Marzana Anna Mikaluska. That's going to be my best guess. And hopefully I'm not too far off. But Mars was somebody who worked in a company. I was the chief psychology officer for a VR company, and she was, I believe, the lead UX designer. And there was just something really special about her. So as I was formulating the chapters for this book and who I wanted the authors to be and all of that, she really stood out to me. But she had never written anything before, and she was quite nervous about it. But I have to tell you, she did an amazing job. Overall, amazing job. And then on top of it, never having written, wow. And then on top of it, that English is not her first language, bigger wow. So then we add on top of it the topic. And her topic is accessibility components in virtual reality. An important piece of all of this discussion in virtual reality, immersive technology, in mental health is also development and how the user interacts with the environment, how the environment responds to, and in a sense, interacts with the user. And this is Mars's specialty. So in this chapter, she's talking about really some fundamentals with accessibility, disability, inclusivity. And she makes a point to say she understands very well that in different communities, there are different uses of words and descriptors that are very important to each of those communities, and she honors that. And it's also something that there really wasn't space for. I mean, I didn't give any of these authors that many words to go by, meaning, they had a word count and they had to stick with it. So, but she does acknowledge that, which just really speaks to the integrity that Mars brings to this conversation. She talks about digital exclusion, inclusion, assistive technologies, design, immersion, and presence. She has accessibility components that she lists and then even gives a checklist. So if you are a person who is involved in any part of the process, whether that's like me as a chief psychology officer, informing the development, informing the interactions, informing the environment, informing the exercises, all of that kind of stuff, you're someone on the design team who is giving the framework, giving the structure, doing the details. This is a chapter for you, 100%. If you're a clinician, this is also a chapter for you because this is discussing the components that we want to look for when we are utilizing or even vetting a program to be used in mental health. So please, please, please read this chapter. It is amazing. Keep it. Make some checklists for yourself in your work and in your projects. I think you're going to really enjoy it.